According to the American Nurses Association, 1 in 4 nurses nationwide is either verbally or physically assaulted in their career. Nurses across the country and in the metro now say violence in the workplace from patients and their families is happening every day.
I wanted to get into nursing because I wanted to help people and I enjoyed helping people.
I really enjoy getting to be with people on their worst and try to make it better for them.
Helping others during a time of need, caring for them when they're sick or injured. For nurses, there's a passion that calls them to their profession. But according to multiple surveys, reports, and nurses in the field, it's a career that's putting nurses' lives in danger.
I have been punched and it has connected.
Cindy asked us to conceal her identity. In her more than 20 years of nursing, she says her job has gotten more dangerous.
I've been verbally assaulted in a way that I can never forget.
Monica, another Metro nurse who also wants to remain anonymous, can't forget the recent attack by a patient that endangered the life of her unborn baby.
I was about 24 weeks pregnant, and a patient came in to the ER that was most likely intoxicated. And she punched me in the stomach. When I told her that I was pregnant, she instantly knew that it wasn't, you could see on her face that it wasn't right, but then proceeded to say some really nasty things about the outcome of my baby.
And she says patients have threatened her life more often than she can count.
I physically have been told, when I leave here, I'm gonna find out who you are, where you live, and I'm gonna kill you. And it's just you kind of just get numb to it all.
Violence against nurses is a serious growing problem, according to the Missouri Nurses Association.
I would say it's an epidemic. It's a massive problem, not just in this state, but also nationally.
What's causing this growing violence? During our investigation, nurses repeatedly pointed to the opioid crisis, behavioral health issues, staff shortages, and what many consider a lack of respect for RNs. A Kansas Hospital Association study backs that up. Some nurses also blame the relatively new patient satisfaction surveys called HCAHPS that are tied to federal funding. It's a survey that patients fill out. Funding and jobs can be affected by these surveys. The Centers for Medicare and Medicaid require the surveys, and hospitals with lower scores get less in government funding.
Hospitals are paid based on satisfaction surveys that are given to patients. A few of the questions are, was your room clean? Was your pain under control?
I would say a majority of the people in healthcare want to make the patient happy, and that's the outcome they want. But sometimes, it's not always what is best for them is what they want.
And nurses say the fear of a bad HCAHPS survey may make them less likely to report violent assaults to superiors.
There's definitely that fear that, if they report it outside, particularly if it goes to the police and gets prosecuted, there is concern that that will hurt their reputation moving forward.
Cindy Samuelson from the Kansas Hospital Association says the underreporting is partially due to the empathy nurses feel for their patients.
If that patient has dementia or is under a lot of stress, they may say they really didn't mean to do it. But we still want folks to report it so we can address it and prevent it from ever happening again.
Patients are the most likely to assault nurses, according to the Workplace Violence Survey by the KHA. Nearly 73% of nurses and other hospital workers polled in the Sunflower State said patients initiated the violence. Nearly 13% said patients' family members started the violence. About 46% said violence happens 1 to 3 times yearly, but depending on the facility, acts of violence can happen daily.
We saw in the survey that 30% of the individuals surveyed felt like it was more workplace violence than a year ago.
Pretty frequently, I would say at least at some form, whether it's verbal or physical, daily. It's nothing for a physical assault to happen on a daily basis.
Nurses and their advocates say it's time for a change.
I get very angry. And it's just we're just trying to do our jobs. We're just trying to, come to work, do our jobs, do it well, and then, go home and be with our family.
To address this increasing violence, some states, including Missouri, have tougher laws and heightened penalties for those who assault nurses and other healthcare workers. Other states require hospitals to have mandatory workplace violence prevention programs. Many hospitals have beefed up security teams, and some nursing schools warn students about workplace violence and offer de-escalation training. Monica, however, said the training she got in school was unrealistic.
For example, if someone's choking you, you're supposed to ask them to stop, and it's not really realistic. If someone's already to the point where they have their hands on you, asking someone to stop is not probably the case.
It's a tricky balance because while defending themselves, nurses have to be careful to not injure the patient they're caring for.
It's an issue. Somebody could lose their job because somebody attacked them and they, tried to keep from getting hurt.
Even with the threat of violence, nurses we talk to say they still love their job.
When you help people, when you improve their life, and when you see their joy, when you can improve upon their outcomes.
But if they could do it all over again, would they choose nursing?
But that's a hard question because I sure love what I do. I would definitely be looking at other careers.
I don't know if I would do it again.
Missouri State Senator Wayne Wallingford introduced a bill last session that would require hospitals to have workplace violence prevention plans. The measure didn't gain any traction. Wallingford's office, however, told Fox 4 the senator will reintroduce that bill in December. One final note, Monica filed a police report against the woman who assaulted her and her unborn child, and that case is pending. Abby Eden, Fox 4 News, working for you.